Surgeries are complex, and viewers are human. Today, you'll learn how to create surgery animations that explain every step clearly while keeping audiences comfortable and engaged. Before going to the production, we have two things to remember. 1, you have to understand the audience. Clarity starts with empathy. Who is this for? What do they need to know and how do they feel? Patients need reassurance in plain language. Students need anatomical logic and technique. Clinicians need precision. Define the emotional state and knowledge level first. Your tone, detail, and pacing follow. And 2, remember to ground everything in evidence. Pull from guidelines, atlases, and peer-reviewed sources, then validate with surgeons or specialists at each milestone. Script, storyboard, animatic, and final collaboration prevents errors and builds trust. Now, let's get into our guide to successful production. First, choose narrative and visual approach. A good narrative breaks down the surgery into clear, easy-to-follow parts. At F.Learning Studio, we simplify medical jargon by translating complex terms into everyday language while keeping the content accurate. Precision builds trust, so simplification should never mean distortion. For visuals, pick a style that fits the topic. A serious surgery might need a professional tone, while a general education piece can feel warmer and more approachable. Use symbols to convey key ideas quickly, and abstraction to soften sensitive visuals, showing essential steps without unnecessary intensity. Second, choose mindful animation techniques. When we talk about choosing mindful animation techniques, we make sure that watching animated surgery videos is a comfortable and smooth experience for everyone. Instead of presenting lots of information at once, we reveal details gradually, like opening a present one layer at a time. This way, viewers can absorb information easily. We also want viewers to feel like they're in control. So, we build in interaction features like being able to pause, rewind, or skip parts. Viewers get to decide their learning pace. Then we set strategic pacing. Keep the animation flowing naturally. Not too fast to confuse, not too slow to bore. Next, create a script and storyboard. Your script is the blueprint. Your storyboard is the build plan. Write voiceover first in short sentences, then block every shot. Framing, labels, transitions, and what not to show. Number 4, choose between 2D and 3D animation. With 2D animation, it's cost-effective and quick to produce. Best for simplifying complex topics for broad audiences. 3D animation is highly realistic and detailed. It's ideal for demonstrating precise surgical steps in anatomy. It's also engaging and immersive, perfect for medical training or device visualization. Your choice depends on the project's goals, budget, and desired detail. Many teams choose to blend both. 2D for context, 3D for the close-ups. 5, pick sound and music. Sound enhances emotion and focus. Use calm, supportive background music and clear narration to guide viewers. Avoid harsh or visceral effects. Audio should complement visuals, not overwhelm them. A balanced soundscape helps maintain comfort and engagement. And 6, testing and feedback. Before final delivery, test your video with a mix of medical experts and target viewers. Ask them, was anything confusing? Uncomfortable? What would you change? Use their insights to fine-tune details, ensuring the final animation educates effectively while respecting viewer sensitivity. Want more practical breakdowns on medical animation, patient communication, and learning design? Subscribe and explore our tutorials and case walkthroughs. If you need help producing a sensitive, accurate surgery explainer, we're happy to collaborate.